I think Our Bodies, Our Cells has been the gold standard for evidence-based information about women's health and sexuality across the lifespan. Originally, when we first got going, we were not too impressed with the evidence that was there for lots of things done routinely, whether it was episiotomy or cesarean section or all the routine hysterectomies, the use of psychotropic drugs, particularly things like Valium and Librium, tricyclic antidepressants. We learned later that there were few good data to support the massive use of drugs and surgical procedures that were used so much of the time. And it was our increasing contact with people in the public health field and with epidemiologists that educated us, as largely a group of lay women, that we needed to understand those aspects, not just what we saw in the medical literature. And of course, those who know what the Cochrane collaboration is about know that Archie Cochrane gave obstetrics and gynecology the wooden spoon way back when he started this whole endeavor into pushing for more evidence-based medicine in practice. And we know full well that evidence-based medicine is not the be-all and end-all for decision-making, but it's an important piece of the picture, and we all want to know what evidence is out there for, say, a routine practice that we see in medicine, and certainly for women's health, because of the Women's Health Initiative, which was NIH funded, and many other studies that have been carried out over the last few decades. We've learned a lot, and we've got much better database for what we do in obstetrics and gynecology and in other spheres of women's health. Our Bodies, Our Cells was one of the major voices calling for the Office of Research on Women's Health, and one of our advisory board members, Dr. Vivian Pinn, has been a really wonderful ally in pushing the envelope on getting certain important areas researched on behalf of women, looking at gender bias in research and those kinds of things, not just in terms of what we study, but also in terms of who gets to do the research. Women as researchers experienced a lot of discrimination, and so NIH has been looking at that over the years. We've been very happy and really gratified to see the number of people in the research community who donated their time to vet sections and materials in Our Bodies, Our Cells, to read chapters, to give their feedback, whether they're clinicians or researchers, public health folks. The quality of all these editions of Our Bodies, Our Cells, especially the 2011 edition, would not be what it is if it weren't for all these volunteers who stepped up to the plate and helped us out.